Well, good morning, everyone, and welcome to today's webinar. My name is Adrian Walker. I'm the Director of Government Affairs and Community Relations for the Flint and Genesee Chamber of Commerce. And I just want to thank all of you for joining us for today's webinar. Joining us for today's webinar, we have our federal delegation with us. We have United States Senator Debbie Stabenow, we have United States Senator Gary Peters, and we have our very own Congressman Dan Kildee. The purpose of today's webinar is for our business community to hear information directly from our federal leaders as it relates to the current packages that have already passed Congress, the 3 emergency aid packages, but to also get a preview from our federal elected officials about what's coming down the pipe from a federal and congressional standpoint as it relates to further relief packages to address the ongoing coronavirus crisis. Today, we've also asked our members to pre-submit questions that we will be asking during our Q&A portion. We hope to get to as many as we can. If we don't get a chance to get to all of them, I promise I will email the questions that we don't get to our federal representation so that they can get back to us with answers. With that being said, I wanted to bring up United States Senator Debbie Stabenow to talk to us about the work that she's doing at the federal level to continue to address this crisis. And Senator, also, I wanted to see if you wouldn't mind also talking about your role as the ranking member on the Senate Agriculture Committee and just what the work that you all are doing to address some of the issues that or concerns that are coming around food security, whether it be food shortages or just the food supply chain during this time. Senator Stabenow?
Well, thank you, Adrian. Thank you to you and to Tim for his leadership, and appreciate everybody being with us today. I mean, it is needless to say, an incredibly challenging, difficult time on all fronts. And I'm glad to be part of a congressional team with Senator Peters and Congressman Kildee. We are literally on the phone all the time and pushing for everything that we can do, not only for Michigan as a whole, but for Genesee County and Flint in the surrounding areas. Let me first just say that in the CARES package that we passed, we had 2 big goals. One was, of course, the most important thing is we're in a health pandemic. So we've got to get our arms around this. We've got to make sure our hospitals, large and small, have what they need. Doctors, nurses, everyone working in the system have what they need, that we're focused on a vaccine, focused on testing, which is having information, knowing who's sick and who's not is the only way we really come out of this with confidence. So you feel confident and the public feels confident in folks going back to work as we need them to do. So healthcare pandemic. Second thing is creating support for individuals and for businesses. The main focus has been on small business, but all sizes of businesses, so that you have income if you have to shut the business down temporarily, if the individual has to stay home because of the business being shut down, or if it's 14 days in quarantine because they've been exposed or they're sick. How do we create a way to provide income? So whether that's unemployment compensation, $1,200 per person in the checks, the small business programs, all of it is focused on keeping people on the payroll, keeping income coming in, how to support you to keep your business intact, which is no small thing. So I'll let colleagues go into more specifics on that, but that has been the focus, large or small. Whether it's helping the airlines, it's through saying, we want you to keep your employees on the payroll. There are 2 million people that work for the airlines. We want to keep as many of them having a paycheck as possible as we go through this. And for every single small business, it obviously is absolutely critical. So let me answer up front the question that I'm sure everybody has, which is the Paycheck Protection Program, the PPP, which has run out of money. They're still processing all of the loans, but we always knew that we'd have to do a second round. I don't know, maybe a third round. The good news is that as of today, it appears, knock on wood, that we're ready to go in the Senate, hopefully on a voice vote with a package that will both extend funding for PPP, about $300 million. Again, we're still working out the final details, but that's what it looks like. Another $50 billion in the economic injury fund, which was actually ran out of money almost immediately. It was up to $10,000 in a loan or a grant for somebody who needed it immediately. And then one challenge has been getting it to people immediately. Part of those funds will be broadened out to include those who've not been able to get the funding because they're either underbanked, they're banked in a less traditional way, whether it be minority businesses, whether it be farmers. I've had a lot of folks approach me because farm credit, even though we had them as part of the lending that was listed, has had a hard time working things out. So some of our small, our rural farmers, our small businesses have been able to get funding. So hopefully that's worked out, that there's timing issues for our independent mom and pop restaurants. They raise concerns. So hopefully that the idea is to fix the glitches that we knew were going to happen because this moved as quickly as it did, and make sure all of our businesses have the opportunity to get this support. The other thing that we'll be doing is adding dollars for hospitals, about $75 billion, critical for healthcare. Again, if we don't get our arms around this, we're never going to be able to get through this if we don't address healthcare. And a very important piece is the next step on testing, because if we don't have information, we're going to have people staying home who could work and people at work who should be staying home. So having said that, Adrian, let me just say on the agriculture front, not only, again, making sure that folks have the resources and access to the loan programs, which has been an issue. I've been on the phone with Greenstone Farm Credit on Saturday, walking through what our rural communities need. But we have a lot of challenges and we're seeing it on TV, both safety of the workers in production plants, particularly around livestock, and how do we keep them safe in such close quarters? And again, that goes back to testing. We need to know who can go to work and who can't. And finally, we have two different kinds of food supply chains in our country. One for grocery stores with individual packaging. That's fine. That's continuing to go. But we also have bulk purchases. And in that situation, whether it's for restaurants, fast food operations, we have an awful lot of folks that are doing large bulk purchasing, and that's where the supply chain, because of lack of demand, has really begun to just shut down. And that's an area that I'm working with USDA to figure out, how we can move forward on it. So, but thank you very much. There's a lot more to talk about. I'll patch it over to my colleagues.
Thank you so much, Senator Stabenow, again, for the update. And next, I would like to bring up our other United States Senator, Gary Peters, to provide us a similar update. But Senator Peters, also hoping that you can also delve into your role as a ranking member on the Homeland Security and Government Affairs Committee and truly talk about the overall jurisdiction that committee has, specifically as it relates to FEMA and the PPE issue that continues to come up within our communities as well.
I will do that, Adrian. Thank you again for hosting this, putting this together. It's certainly great to be here with two of my colleagues. As Debbie mentioned, we're on the phone continuously with each other and with everybody else that we need to be talking to. So it's great to be here with Debbie Stabenow and Dan Kildee as we work together to get through this incredibly challenging time. I look forward to hearing your questions, but I also want to hear your comments. And we may not get to comments here today, but I think I want to make sure you know that's very important that we hear directly from you about some of the challenges that you're facing, ways that we can be helpful as we continue to put together these packages. We'll be on the fourth package this week, as Senator Stabenow mentioned. There'll be more. This will continue to be something that we're going to need to address for a considerable amount of time, and to make sure that we're providing the help that it is needed and to where it is most needed as well. It's important that we get your feedback. To Adrian's question, I am among the other committees I serve on, I'm ranking a member on Homeland Security and Government Affairs. And in terms of its jurisdiction and how it relates to the crisis that we're in right now, I oversee FEMA, and the Federal Emergency Management folks are the ones that are really leading the federal response to the crisis. I'm on the phone with FEMA daily. My staff, committee staff, is with them as well, and we're working closely with the governor's office as well. Some of the challenges that we're facing there, and we continue to face, and we still have to do a much better job, is to make sure that we're getting the personal protection equipment that Adrian mentioned is critically important. We continue to have challenges there. We simply don't make enough personal protection equipment in the United States. Most of this stuff, from masks and gowns and gloves, all comes from overseas. And when you're in the middle of a pandemic, that means countries all across the world all want those same supplies. So it certainly has highlighted a challenge that we have, and something that we have to rectify going forward, that we have to make sure our supply chains are intact. But in the meantime now, we've got to acquire this equipment. We've been making some progress here in Michigan and in Southeast Michigan and Flint, but we still have a ways to go to do that. I am encouraged, and I will say this is really something that I feel very proud of to be a Michigander, is that we're seeing Michigan businesses all across the state are stepping up and starting to make this equipment, even though that's not part of the business that they're engaged in. We're certainly familiar with the auto companies, General Motors, Ford, and Chrysler, all making masks and ventilators. It's kind of in the spirit of the arsenal of democracy that we saw during the Second World War, where the companies stepped up to use their manufacturing muscle to produce that. But it's not just the big three. It's auto suppliers. It's smaller companies that are not necessarily related to the auto industry, but they know how to make stuff that are making it. And I'm very encouraged by the numbers of masks and other equipment that are going to be coming online. The challenge is that you can't just turn on a switch and have that come out right away. So it takes a little while to gear up. But I'm confident you're going to see that manufacturing muscle make a real difference in the weeks and months ahead. But in the short run, we have to continue to bring in this protection equipment. FEMA is now operating an air bridge. They're sending aircraft all across the world to pick up that stuff and bring it in. But we've got to be vigilant, and we literally have to fight. Unfortunately, the federal government still has not really taken charge of this like they should. We haven't seen the president use the Defense Production Act like he should to make sure that we're looking at it in a coordinated fashion. Oftentimes now states have to compete with each other for personal protection equipment. That makes no sense whatsoever. And the same occurs also for the testing and supplies. It's not just lab capacity. We also need swabs. We need the reagents that you use in this testing. That also is something that we have to have a coordinated federal response. It's not working the way I would like it to do. We're going to continue to press that issue as aggressively as we can. The other issue I'll bring up that I'm focused on right now is also drugs and the drug supply. We're starting to see shortages in some critical drugs. Again, many of those drugs are produced overseas. They're not produced here in the United States. I actually did a report, a pretty comprehensive report last year on potential drug shortages, and we highlighted the problem that would occur if there was a pandemic. And that's because many of the precursors of the drugs, that go into making those drugs are made in China and India. In fact, over 85% of those precursors. So it puts us in a very precarious situation. To me, it was a homeland security issue. We have to make sure we're producing this stuff going forward. We got to make it in America. It's going to be absolutely critical. And now we know for sure that it is absolutely essential that we do it. And it's similar when I say homeland security. It's like we build warships. We make sure we have the capability to build warships in the United States, and tanks and armored vehicles. I'm a member of the Armed Services Committee. We understand that's part of national security. Well, when it comes to the health and welfare of Americans, that's homeland security, national security. We're going to have to be working on that issue as well. I'll mention one area that I worked a lot on in the CARES Act was unemployment assistance, expanding that. In fact, the Pandemic Assistance Act is the bill that I wrote that's actually in the CARES Act, which expands the eligibility for unemployment to folks who traditionally don't get unemployment. And that means business owners. As a small business owner, if you suddenly now find yourself without an income stream, you can get unemployment. You can get on unemployment. If you are an independent contractor, if you are a gig employee, if you do freelance work, you can now apply for unemployment and get on it. If you're a part-time worker, if you are just a worker who just started a job and suddenly had the rug pulled out from under you, you can qualify for it. It's basically patterned on how we deal with hurricanes and other national disasters. The same kind of concepts are now put in place for this pandemic. I would also encourage folks to take a look at expanded work share. I've been working closely with the state of Michigan on work share programs. So if you have employees who you can keep on your payroll for a period of time or for a number of hours, but you can't give them the full 40 hours that they may have worked before until businesses start opening up more, you can get into the work share program and have the additional hours paid for through the unemployment system, so you can keep people on the payroll. So this is another opportunity, in addition to the payroll protection program that you're all well aware of, and we're going to be funding with additional resources this week. But that's another tool. I've talked to the folks on unemployment just recently. They have 1.1 million applications right now for unemployment. That's 23% of our workforce is now applied for unemployment. It's an unprecedented number. It is well in excess of what we saw in the last major recession, the Great Recession. And it basically, our unemployment numbers are equal to the number of jobs that have been created over the last decade that all went away this last month. So we've really got to make sure that we're helping people put food on the table and to be able to have a roof over their head. I'll just mention one last issue there, Adrian, is that I'm also part of my jurisdiction in Homeland Security and Government Affairs as I oversee the Postal Service. Mm-hmm. Postal Service is going through a real challenge right now. In fact, we had heard as we were going into the crisis that they were going to be insolvent in September if they did not get help, which is a big deal. And I know many of the folks here in the chamber use the Postal Service daily, and it's critical for your business is that we have a functioning Postal Service. I was able to negotiate in the package a $10 billion loan for the Postal Service to keep them solvent through the early part of next year. But right now, their revenues have dropped over 50% here during the pandemic. And as business owners, you know, when your revenues drop 50% when you're already struggling, that's a real crisis for them. So I'm going to continue to work to make sure that we have a postal service, but it's going to take a combination of some reorganization and some infusion of cash to make sure that they continue to be vibrant. It's just so critical for our small businesses and for our state.
Senator, could you also talk about the proposal, the HEROES Fund that deals with the hazard pay for those workers that are on the front lines?
Absolutely, Adrian. I have a proposal that is broadly supported by folks in the delegation, Senator Stabenow, Dan Kildee, and others, that will look at our heroes who are on the front lines, who are in necessary jobs. Many of us are able to shelter in place at home, work via our online applications. But as you know, many people have to show up to work. The only way they get a paycheck, they have to show up to work. They need to do it. But we also need them to do it. So we will think about certainly our health professionals, our nurses and doctors. Clearly, they have to show up to work. We need them. But it's not just them. We also need the custodians and the janitors in the hospital. They are necessary workers. If they don't keep the hospital sterilized and clean, the hospital's not going to be able to function like it should. But it's also our grocery store clerks who make sure there's food on the shelf so we can go and get food and then go back to our home to shelter in place. It's folks in pharmacies. It's those postal workers that I mentioned that are delivering the mail and medicines to people. It's our frontline first responders, our law enforcement, and other first line folks that all have to show up, and we need them to. And certainly they deserve our thanks, but they deserve more than our thanks. They also deserve some financial help. Basically like hazard pay. It is hazard pay. When they show up to work for us, they're putting themselves and they're putting their families at risk. We should compensate for that risk, similar that we do in the military. If you're in a combat zone, you get more money because you're in a combat zone, you're exposed to greater risk. The same concept should apply. So we're looking to try to put this in place. And what it'll do is basically on top of whatever that employee is earning in their job, it would be a bonus of $13 an hour on top of that during the pandemic, capped at $25,000, but it would be $13 extra. So in addition to our verbal thanks, which I hope every one of us gives every time we're in a grocery store or anywhere else, but if we can also put something in their pocket to help their families get through this, I think it's something that we should all do collectively as a country.
That's awesome. Well, thank you, Senator Peters. We'll be back in touch with you during our Q&A portion. And now I want to move on to Congressman Kildee, as he's also been fighting on the front lines of this crisis. So Senator Stabenow mentioned the Paycheck Protection Program, and Congressman, I know you led a letter to the SBA with other members from our Michigan Congressional delegation, weighing in on some of the concerns that you had with Michigan being one of the highest states that's been hit with the coronavirus, but also the second highest as it relates to unemployment claims. Yet we ranked, I believe, 35th in the U.S. as it relates to access to the Small Business Association's Paycheck Protection Program. But then also, Senator, you are also on the Ways and Means Committee, which has jurisdiction over a number of things, including the unemployment insurance program. So we'd just love for you to talk about the work that you're currently doing right now.
Sure, and thanks, Adrian, for hosting this, and thanks for the work of the chamber in getting us connected to the small businesses, the community businesses that we know need a lot of help. And it's been great to work with Senator Stabenow and Senator Peters on these issues. They've been great champions. And for me, being a Flint kid, growing up here, the fact that they have always had our back whenever we've been in need, they've been there. This is just another example of that. We've passed 3 really big pieces of legislation in a bipartisan fashion, all in the month of March. It's pretty unusual to see that kind of national resolve and bipartisanship. But having said that, the details in these bills matter. The Paycheck Protection Program, for example, we have been working not only to just get additional money, which is important and absolutely something we have to do, but we want to get it right, because simply to put more money into the program, that's important. But it's also very important that the money get to the businesses that really need the help. And that's why we raised this question. We have the 5th most cases in the country here in Michigan, the 3rd highest death rate, number of deaths, 2nd highest unemployment, as you said. But then somehow the way the SBA program has been working, as a percentage of businesses that are eligible, we ranked 35th out of 50 states. That's why it took us an extra couple of days to push back against the way the supplemental was originally crafted, to make sure that we had language in the legislation that gets to those businesses in Michigan that were somehow being overlooked. And I'm sure you've all heard about it. We've heard about it as well. There are lots of businesses that got in line, made their application, clearly qualified, but by the time their application came up, the money was gone. But in some cases, it wasn't clear that they were going to qualify. We want to make sure that we correct some of those errors. So I think we have a much better product now as a result of the work that's been taking place, particularly led by our senators over the last several days. So I think we need to go further. I have legislation that would establish a Main Street Emergency Fund that would essentially go around the forgivable loan program for those very small businesses with 20 or fewer employees, particularly in chronically distressed communities, so that we could just get more relief grants out the door to those. And I've been working on that. I hope to see some progress on that pretty soon. The only other point that I'll make, because the 2 senators have done a good job of framing the issues that we're facing, I think it's really important to keep in mind a couple of things. One, that while sometimes we talk about this as being a health crisis and an economic crisis, the 2 overlap, obviously, almost entirely. The economic intervention that Congress has passed is not just about continuing to support local businesses and individuals who are struggling financially, but also to give those people the tools they need, the financial tools, to follow the medical guidance that is saving lives, to be able to stay at home if you're not an essential worker, to be able to shelter in place, requires financial resources. So while we think about the 2 buckets essentially being separated, there's a high degree of overlap. And I think it's important for us to remind ourselves that when we are providing unemployment benefits, when we are providing support to small businesses, not only are we dealing with the economic crisis, but we are empowering those individuals to follow the medical guidance that they're being given, to shelter in place, to stay at home, to minimize the spread of this virus and by doing so, quite literally, to save lives. I think the last couple of big remaining questions that we're still dealing with has to do with the focus on testing. It's been very frustrating that testing has not been as high a priority for some within the federal government constellation as it is for those of us on this call. We believe that testing is critical, not only in terms of the diagnostic testing that's required in order to get the medical support to those people who are carriers of COVID-19, who might be experiencing symptoms. Testing is important in that regard. But a really robust, far more significant emphasis on testing will be absolutely required as we begin to transition from the peak of the crisis into the methodical effort to stand up the economy. If we don't have good data that helps us make decisions about the rate at which we can get back to whatever the new normal looks like in the sectors within the economy that are best positioned to get back to basically back to business again, we're going to need data to help make those decisions. And that data has to come in the form of far more, dramatically more, exponentially greater focus on testing. And so in the legislation that we are considering, the Senate hopefully takes that up today, I believe, and I'm going to have to go to Washington because one of my Republican colleagues is going to object, apparently, to us dealing with this through unanimous consent. So I'll have to go down there to vote, which is fine. It's what we do. We'll have significant additional support, I think about $25 billion, to push the administration to emphasize testing in a far greater fashion than they have. And then the last remaining point, for the stimulus payments that have been going out, for the Paycheck Protection Program, for the unemployment compensation, as we start to look at not this supplement, but CARES 2, the next big piece of legislation, we're going to have a real serious conversation about the length of time over which these benefits will be provided. Right now, the Paycheck Protection Program covers 8 weeks of expenses. For some companies, that may be adequate before they can get back on their feet. But in some sectors of the economy, it's going to take much longer than that. So for the PPP program and for the unemployment program, we're going to have to look realistically about how long those benefits will have to be made available to American companies and to American individuals in order to make sure that the transition back to whatever that new normal looks like happens with the least amount of damage. With that, I'll stop and turn it back, and I really appreciate the opportunity.
Oh, thank you, Congressman Kildee, for the update, and just ask that we bring everyone back together so we can start the Q&A portion. As I mentioned at the beginning of our call, we asked some of our members and our viewers to reach out to us with some of the questions that they had. Again, unfortunately, I know we won't be able to get to all of them, but I want to make sure that we use the time that we have to get to some. Senator Peters, want to start with you with a question from Marcy Hemmisberg, who's a City of Flint resident. Her question is, there's a lot of talk about naming frontline workers as first responders, yet emergency telecommunication specialists, aka 911 dispatchers, are mostly classified as secretaries. And she says mostly because when dispatchers are asked for government help given to first responders, they're denied. But when wanting to leave to child care for their children during this crisis, they're denied and told because of their first responder status that they have to stay. Is there anything even in the future to reclassify the very first responders in the emergency chain of events? And this probably, Senator Peters, relates to going back to that HERO fund, who again would qualify as it relates to that fund and that designation as frontline and emergency workers.
Right. Well, thank you, Adrian. Thanks for the question. There's no question that necessary workers, that we're still trying to define exactly how you do that, but certainly someone who's absolutely essential. And I think we all agree, folks at 911 who are taking those calls are essential personnel, that they take those calls, handle them. I've had the privilege of actually being in those centers on a few occasions and hear the calls that come in and the skill by which those operators are able to handle those calls. I mean, you're dealing with somebody who's on the other end who's very stressed, probably, and you have to talk through them, get the kind of information that you need. And once you get that information, you send somebody out to the house or wherever they may be. They also stay on the call to work with it. These are highly skilled individuals, really skilled, that are in the front lines, that are absolutely essential, so should qualify that. I'm actually co-sponsoring a legislation to change that classification, as was asked there. It's the 911 Saves Act, which would classify them as first responders and treat them the way they should be. We also know that because of that stress, and I'm sure the questioner can talk at length about that kind of stress, and the fact that PTSD shows up in our folks who are working those lines at 911. So to me, this is the right thing to do. I've co-sponsored legislation to do that. We're going to work to try to get it passed. And certainly they are among the heroes. When we talk about a HEROES Act, they're among those heroes.
Great. Thank you, Senator Peters. Senator Stabenow, this next question will be for you, and it deals with testing, whether it's publication, anything that we've heard. We understand that testing will be key towards to reopening, our economy. The next question comes in from Heather Bachman. She's a City of Fenton resident, and she says she wants to know a safe place where she can go to get a test done, and how is she going to keep herself safe when she's forced to go back to work?
This is such an important question, and I think is one of the keys, if not the fundamental key, to opening up the economy. First, the good news is that the state has now opened a number of drive-through testing sites around the state, and one is in Flint. It's being operated with Hurley, and it's at the Atwood Stadium, and it's going to, the goal is to be open 3 days a week. And so that's the place to go. Now, you do need to contact the health department, Genesee County Health Department, or a physician or someone ahead of time to be able to describe your symptoms, because unfortunately there's just not enough testing supplies right now to just have people drive up that haven't in some way received a letter, an okay or something, email from somebody recommending that they get a test. But I would suggest there's a hotline, Genesee County Health Department. There's one through the state of Michigan, but I would start there. And then certainly any one of us can help if you have additional questions. Let me also urge that you go to my website, where with my hat on as heading a policy committee, we just released a report last week on testing, sort of the approach that the United States took at the very beginning versus other countries that have done much more and got their arms around this. But in addition, what we need to be doing now. All of the experts now say that in order for us to really evaluate getting back to work in May, we need 5 million tests between now and then, and we're on the road to get 1 million. I mean, they're recommending, eventually 500,000 tests a day. And what does that mean? What does that look like? Well, there's a lot of research being done to do an instantaneous kind of test. We've seen where it's been very helpful right now, the Abbott 15-minute test, which the mayor of Detroit was able to get at the front of the line and get some of those tests, because he had about 500 police officers staying home in quarantine, exposed, but they didn't know if they had the virus. So now they go in every day, they take the test. If they are negative on the test, they go to work. If they are positive, they go home. That's what we should be doing, so that whether it's going into the restaurant, whether it's going into the auto plant, going into the nursing home, or the livestock processing plant, whatever it is, something quick. And they are developing right now and trying to figure out what's really effective, where you could do a swab or saliva test, and then you would feel confident as an employer. Your employees would feel confident. Your customers would feel confident that the people that are there are people who've been tested negative. That's the vision around which we need to be pushing, because we want the vaccine. Once we have the vaccine, ball game changes. That right now, before that, we can't continue to have the strategy be everybody stays at home. We have to have only the people that test positive at home. And to get that, you have to have testing that works for you and your employees and for the community.
Thank you, Senator. And Senator, during your remarks, you mentioned the Abbott testing and the quick response time that testing provides. I understand right now it's in the Metro Detroit area. Any conversations around a timeline or to where the scaling of that testing will reach other communities?
Many questions around that. We are pushing Abbott very, very hard. And there are also others. There are folks like Bill Gates, who has been involved in this immediate kind of testing using a swab. And so there's a lot of folks pushing on this. But this goes back to what Senator Peters said about having access to the elements of the test. Right now, we have one supplier in the whole United States that makes swabs that are necessary for this. And a couple of weeks ago, they were completely out. Now they're revamping. We've got to, go to other countries for this. There's something called reagents, which are the chemicals that are involved in doing the test. It's not the machines. There's all kinds of machines out there, but each one, depending on who made the machine, requires a different test kit. And in the test kit, it requires something called a reagent, which is different depending on the machine, which is one of the problems. And so folks are rushing hard. Folks at Michigan State have been looking at how you could do testing kits across platforms. And they've got a suggestion right now that they're more than a suggestion, a proposal to FDA to how we could use different testing kits, different machines, and so on. But it is more, it's not about Abbott machines. It's about having enough materials to have the tests. And that's what we have been focused on.
Okay, thank you. Thank you, Senator. Congressman, this next question will be from you. It's from Otto Muhammad, who is a City of Flint resident. Congressman, he wants to know, what is Congress doing to permanently reestablish or reinstate the pandemic rapid response team at the federal level and prevent the administration, either current or future, from unilaterally dismantling it? Shouldn't Congress include that as a part of any appropriations bill being considered during this emergency?
Well, it's a really good question. And I think one of the reasons that it has been difficult for the U.S. to respond, and there's just no two ways, there's no way to be diplomatic about this, is that the president eliminated the pandemic response team from his team within the National Security Council. That was a mistake. It's a mistake that has to be corrected. And we, in our roles in the House and the Senate, we are in the resource and policy business. We supply the resources, and we, with those resources, direct policy. It's up to the administration to make sure that they faithfully execute the laws that Congress passes. There will be a time in the not too distant future where we will do a much more critical after action review. Right now, our goal is to work with this president to try to be as successful as we can and make him as successful as possible in dealing with this terrible crisis, because quite literally lives are at stake. But I think you can rest assured, and I'm sure the two senators, I've heard them say the same thing, that they'll agree. There are lessons that we have learned from this. Some of the lessons will require serious additional action. The issue about how we stand up, for example, American industry quickly to deal with the material needs that we have. It's been amazing to see American industry turn as quickly as they have, but I think we have to be better prepared for that. But I think it's especially important that we have our defenses up. Over at the Pentagon, the Defense Department has a plan for virtually every kind of military attack that we could possibly face, from state and non-state actors, you name it. We need to have our defenses up when it comes to something like this. And unfortunately, for reasons that are obviously going to become a subject of a lot of exploration, the White House decided to stand down when it comes to pandemic preparedness. And that turned out to be a very tragic mistake.
Thank you, Congressman Kildee, for that response. I know we're coming close on time ending, so I do want to provide each of you an opportunity to provide any last remarks for our viewers listening regarding anything that may have been shared or just anything else that you will want to say. And Senator Stabenow, I want to start with you.
Well, first of all, thanks very much, Adrian, to you, and Tim, to everybody. Let me just say, we're going to get through this. This is unlike anything we've had to deal with, but we are seeing folks stepping up every day. And I want to thank the businesses in Flint that have stepped up to retool, to make the face shields, to make the masks, the gowns, the gloves. Flint and Genesee County is an example of what we do as Michiganians. And what we also know is in the long run, you know, we are the state that makes things and grows things. And we are seeing the dependence on both of those things going forward. And so we need to be laser focused on how we play a big role in coming out of this and making sure that we have those things that will keep us safe from a healthcare and national security standpoint. So thanks for all you're doing.
Thank you, Senator Stabenow. Senator Peters.
Well, thank you, Adrian. Again, thank you for this and all of your members for being with us here today. I just want to mention two items and then do a brief wrap up. First off, on the Paycheck Protection Plan and those 7A loans, I think it's important to remind folks that it's not just small businesses in the traditional sense that can apply. It's also our nonprofits. And when you think about what we're dealing with right now in this crisis, we need our nonprofit sector more than ever. Their services are invaluable. They are under significant financial strain like everyone. Donations are not coming into their organizations like they normally would. And think about our food banks that are providing essential food for folks. So we've got to make sure that they get the resources they need and they can keep people on their payroll as well. So I hope they were often don't deal with the Small Business Administration, aren't necessarily working on with 7A loans. They can do it. We need to make sure we're reaching out to those nonprofits throughout the greater Flint area to let them know that there is help available for them too in that process. The other one I want to just touch briefly as well is that one thing that this crisis has definitely highlighted is the disparity in healthcare and how communities of color in particular are being impacted in a dramatic fashion. And there are a lot of reasons for that, and we need to do a very deep dive into those reasons going forward. It's been highlighted, but one of those is having access to quality, affordable health care. Having the Affordable Care Act has been incredibly important. It's reduced the number of uninsured folks in Flint dramatically since it's come forward and other places. But we should be opening up the enrollment right now. Dan Kildee and Debbie Stabenow and I have been leaning in saying we should have an open enrollment period for folks to get into healthcare. At a time when we're in a pandemic, that is a reason why everybody should have access to quality, affordable healthcare. If we can open up the enrollment for the Affordable Care Act, people will know they have that coverage should they get sick. So we are going to continue to work. Again, we are going to get through this. We've gone through really tough times in our country in the past. We've always come together. We've always gotten through it, and we're always stronger at the other end. And I'm confident with your leadership and the leadership of the chamber, everybody on this webinar is a leader in the community. Together, we're going to get through this and we're going to be stronger. So thank you for including me.
Thank you, Senator Peters. And Congressman Kildee.
Well, first of all, thanks for doing the call. And it's always good to not only talk to my two Senate colleagues, but in this case, actually be able to see them. We miss one another. We work really closely together, and this whole pandemic is no exception. We've got a lot on our plate. We get good ideas from local business people every single day. Some of what we have included in this most recent iteration of federal intervention comes directly from ideas that the people on this call have given us, that the small businesses in our community have given us. They help us understand how this is really affecting them. So I look forward and invite further input. I think it is important to point out that we've got to do something to help local government. That's been one of the priorities. I know both senators have mentioned the need to include that. Unfortunately, we did not get that in this package. There are some of our colleagues who were just not prepared to go there. But the cascading impact on businesses, on individuals, and ultimately on government receipts is going to have a negative consequence on the public services that those local governments provide. And so as we're looking at the whole panoply of resources that we need to direct, it's important that we keep in mind that local governments, especially state government for sure, but local governments, the smaller governments, are going to need additional help. And I know the three of us are committed to see that through. So thank you all. I really appreciate the opportunity to be a part of this.
No, again, and we want to thank all of you again. Thank you, Senator Stabenow. Thank you, Senator Peters, and thank you, Congressman Kildee, for joining us on today's call. We want to thank all of our viewers for tuning in. I also want to give a personal thanks to each of your staff who we've been working with to bring back information to our members who are submitting questions to us about what's going on at the federal level. So also want to say a personal thank you. Want to encourage all of our viewers to tune in tomorrow. Today we've had our federal delegation. Tomorrow we'll have our state delegation with us. We'll have a conversation with Lieutenant Governor Garland Gilchrist, State Senator Jim Ananick, and we'll also have the Director of the Unemployment Insurance Agency, Jeff Donofrio, on the call. So that call is tomorrow at 10:30. Again, thank you for tuning in and look forward to seeing all of you soon.
Thank you.
Thank you.
Thank you.